The tragic death of Michael Jackson has brought the issue of recreational drug use into the spotlight. There's been a number of newspaper articles as well as coverage across the TV networks regarding allegations of substance abuse. I'm here to say at this point it's pure speculation, and until we have the results of toxicology and a full report by the coroner, that it does a disservice to Mr. Jackson, his family, and all his supporters. And for that reason, I'm not going to address what might have happened in his particular case. As for the subject of recreational drug use, it's a major problem in the city of Los Angeles as well as across the country. Over the last several years, as an addictionist and pain doctor, I've had the opportunity to treat a number of celebrities who have used medications on a recreational basis. This falls into two categories: prescription drugs as well as street medications. They often overlap, but the difficulty that a treating physician has in dealing with this is in assessing the compliance and interest in a changing lifestyle among these patients. As everyone in my business knows, recreational drug users can get their medications from a number of sources. There are pain physicians and general practitioners across the city who are more than willing to stretch the indications for prescribing opioids as well as benzodiazepines. For that reason, when treating a patient who you suspect of using drugs to excess, either for an indication or for recreational purposes, we have to make sure that they get their medications from only a single treating physician. This is an ongoing problem. Patients can get their medications from a number of sources. As for the question of substance abuse and the prospect of overdose, the issues that we must deal with as treating physicians cover a number of areas. The kind of medication a patient's using, the frequency, the route in which it's being administered, and of course when they last received their drug. A drug overdose, in the case of pain medication, follows some predictable routes. The most vulnerable organ systems in the body are the heart and the central nervous system, specifically the brain. When one takes opioids, painkillers, it depresses respirations. The central nervous system is depressed and breathing slows down. As a result, carbon dioxide builds up in the body and oxygen levels can be reduced. If they reach a critical level of diminished oxygen, the heart and the brain both suffer. And the common denominator in this case would be a cardiac arrest or an abnormal heart rhythm, not indifferent than what we see when someone has a heart attack. The treatment for an overdose is to reverse the underlying causes. And that, in this particular case, in the case of opioid medication, that would mean reversing the opioid effects, ventilating the patient, supplying oxygen, and making sure that they're breathing appropriately, and supporting all the vital signs. If that isn't done in a very short period of time, there's a great chance that once an abnormal heart rhythm is started, that the patient cannot be retrieved, and that there will be death as an offshoot of the cardiac arrhythmia. As far as the treatment of opioid abuse goes, there are a number of new techniques at our disposal. The most important thing is terminating drug use and, in fact, preventing relapse. Unfortunately, the data shows that when people have been opioid dependent for a significant period of time, that their risk for relapse is significant. The data suggests that within 6 months, 80 to 90% of patients will be back using opioids, if that is their drug of choice. One thing I will mention is the fact that recreational drug users are often multi-drug users. When we do toxicology screens, we'll see that patients often have 2, 3, or even more different kinds of medications in their system. So, for the purposes of evaluating someone's risks for relapse as well as their commitment to changing lifestyle, identifying the drugs of choice, whether it be OxyContin, Vicodin, heroin, methadone, or sedative hypnotics such as benzodiazepines, and by that I mean Ativan, Xanax, Valium. We need to identify the drugs and then create a safe and secure environment through which we can remove the patient from the medications and then give them treatment to prevent relapse.